And so with some of the psychology, so what does that say? I know you had some information about like just the true, genuine benefits of therapy and what it is, and a lot of other stats came up for you.
Yes, I wanted to just give the National Institute of Mental Health, like their definition of psychotherapy, which is also called talk therapy. And their definition is that it refers to a variety of treatments that aim to help a person identify and change troubling emotions, thoughts, and behavior. Most psychotherapy takes place one-on-one with a licensed mental health professional or with other patients in a group setting.
Okay.
Yeah. So I just think that it would be important to like distinguish that this is what therapy is. And so all these other things just don't fall into that category.
Yeah, definitely. And you kind of were alluding to this too, of like the symptom like reduction in things, right? And so that just popped in my mind too as you're reading the definition, because right, individuals come in for the most part with something maybe very specific that's troubling to them. And so how do we help shift that? How do we help change thoughts and shift some of these behaviors? Right. So a lot of action tries to take place in therapy too.
Yeah. And I mean, I think the research has been clear that therapy is effective at reducing a lot of symptoms and helping people manage maybe chronic mental health conditions that maybe they, like you just kind of deal with, where you have it and you experience it and you manage it throughout your life, or to just sort of you no longer meet the criteria for this disorder. Research is pretty clear about that. And there's different forms of therapy. And so maybe different forms have different effectiveness and efficacy and all those things. But yes, therapy, the research is abundantly clear that it is helpful for many different disorders and for many different problems that people walk into the office with.
Yeah. And like, I guess I would say if therapy isn't effective or helpful, one, that happens, right? It's like the risk and benefits of therapy that we go over. And one of the risks is like, you might feel that like this isn't helpful for you at all. And it depends on a lot of things, maybe like your expectations for therapy. Some people have a super high expectation, as if I have like a magic wand and I can just make all their issues go away. And it's just not that easy. But then like the therapeutic relationship itself is important too. And so really finding a therapist that fits you is going to be important. A lot of the research says one of the most like leading contributing factors to like success in therapy is if that relationship with your therapist is like solid. So I just say that to say a lot of people might have the thought of like, therapy doesn't help. I've tried it once. It's not helpful at all. One, that's valid for people if that's their experience. I think that can be true for some people. And also considering that there's maybe some other factors to consider. Because I do feel, and bias probably, but I do feel that like most people that engage in therapy, there can be some benefit to it.
I think that's a really good point. We can't make any promises, and nothing is necessarily 100%. I also think about that any other form of sort of medical treatment, it is not 100% success rate for really anything that I know of. So if you go to a surgery or if you take medication, these are other forms of medical treatment. Maybe it's not initially related to mental health disorders. Maybe some of it is. But these different forms of treatment also, they have a success rate, and that's why we do them. And for many people, it's effective, but also there's a subset of people that it just doesn't work for a myriad of reasons. So I kind of think of therapy in a similar vein. But I think one of the things about therapy that you bring up is like, because it's a big component of it is this human interaction with a trained professional, that I think sometimes the difference may be that maybe it didn't work in this context, it didn't work in this setting, didn't work with this provider. And I also think that a big piece of therapy also hinges upon the individual. And which may be different from other types of medical treatments. Maybe not, I don't know. But I think those things are also really important, and important to note that, maybe this type of therapy wasn't effective for you. It doesn't fit for you. Maybe this relationship you have with this therapist wasn't a good fit. And that's no shade to anybody. It's just, it's like there's so many different kinds of therapy treatments out there and so many different kinds of therapists that I want to encourage people. Like, if it doesn't work with this one, like, I think it's worth trying another time, until you maybe find someone that it does work with, or maybe consider that there might be other factors here. The other thing is that I think it's really important to consider that there are multiple forms of healing, and that I think, as much as I really value therapy and I truly believe in its value, I don't necessarily think that it's always the end all be all, and that it's always the only thing that should be done or needs to be done to help somebody feel better. And so I think I wonder, or I guess I believe often that sometimes when people are going to therapy, for it to be really effective or for them to really feel better, yes, they have to do the therapy, but they also have to do things outside of therapy.
Definitely. Yeah. And I know you have some other forms of maybe healing that are helpful. But yeah, I think that's a huge component. It's this holistic approach of yes, therapy can be helpful. And I always tell my clients, just coming here to talk to me once a week, once every other week, I hope this is helpful for you in this time, but this is not enough. You need things that you're doing outside of here based off of what we're discussing. So we're discussing shifts. Now you have to go practice it or engage in things outside of here that are going to help you make those shifts. But just relying on us maybe won't give you that holistic healing, right? So yeah, I know you have maybe what some research says on other different types of healing. And there is even some research on travel too. So
yeah, I want to highlight your word holistic. Okay. I think that's where I've sort of been moving to in my life and my career, the importance of holistic healing, and that therapy is a component of that. And this is our expertise. But so many other things, like you mentioned, and things that the client has to actually do. So for some people, it may also be including medication. That's probably one of the go-to hand-in-hand things that people do with therapy. They do therapy and they may take medication. Now, this is not, their medication isn't for everyone. Everyone may not want to or choose to, and it may not be necessary. But there's some research that suggests that sometimes for certain disorders, for certain people, that medication and therapy may actually be the gold standard, at least for some time period. And then for some people, they don't need medication, or maybe not for forever, for a long period of time. But there are some other things that science kind of tells us can be helpful. I won't go through everything, but there was a study that was done looking at travel and stress reduction and well-being. And there was some indication that vacations can kind of reduce some stress and improve our health, promote relaxation and better emotional well-being. Now, the study did indicate that some of those effects kind of fade within weeks. And so I think that's something important to know. And that kind of matches up, I don't know, with my own personal experience with vacations, that I do feel great and amazing while I'm in them, unless the vacation is bad, but usually they're good. So I don't know. And afterwards I might feel really good, but then maybe a month later, I'm not still running off of that vacation experience that I had a month ago.
Yeah, exactly. It's not, and that's maybe another deciphering factor between the therapy versus therapeutic. Our goal is with therapy is for it to have some long-term impacts where you don't need us anymore. So you got this long-term. Some of these therapeutic things maybe we engage in, it's really just short-term type things that we do. And I don't even know if their existence is to be long-term, right? Some of these self-care things. And if I go get a massage, that's why I've kind of decreased those. I still like them, but because I'm I pay all this money for the massage, and then in 2 hours I'm all tight again. Come on now.
Stop the press.
They'd be like, come on, you gotta come once a month. Like, nah, I'm not coming more.
Come on, I think we need to do once a month.
Yeah, no.
Okay.
No. But yeah, so the long term, right? So that would be important for people to think about of like, yeah, some of the short term things are great, but not getting over consumed with the short term. And that's like therapy for us. So,
and I think when it comes to vacation, like sometimes a part of this may be like our culture that we like, we've had that hustle and grind conversation already. And like our society often is like, go, 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 go. And then we look to like, oh, we got that week off vacation. It's supposed to be the end all be all. But 1 week or 2 weeks out of a year where you're like doing nothing, but the rest of your life is just so overwhelming and you have all these other things going on that are impacting your mental health. There's no way that a 1 week vacation can change like all of that.
Yeah, definitely. You had some other?
Yeah, so things like mindfulness, which we talk about a lot in therapy, nature.
Yeah, that's your thing.
I know, being in nature and also walking. Yeah, it's super helpful.
And so I will say with like, so I'm not, and people know me, I'm not. I won't say I'm not a nature person. Love nature, the beauty that's out there. But as far as like being in nature, like hikes, camping, negative. Like I won't say never, but like I'm not doing that. Why am I being out there with the bugs and stuff?
We're not talking about bugs. Okay, that's a little too far for me too.
No, so
come on, you can take a hike.
Okay, so I've done a little better. Before years ago, I'm like, a hike, who wants to do that? But I did some hikes, and so that's what I was getting to, like actually being out there. So I don't like the bugs and stuff, but being out there, it's like super therapeutic. Like I don't know what about it, especially depending where you're hiking. If it's like waterfalls and a lot of greenery, but just something about it. Yeah, I really noticed before where I'm like, this is like extremely relaxing, therapeutic, even if it's like a hard hike, but like something about like being out there in nature like that is extremely therapeutic. And I think healing for some people too.
I think so too. And speaking of water, like being around bodies of water has been found, but also just different types of like wellness or health related fields also use kind of water, and water may have some sort of healing type of qualities to it.
Like, like float spas.
Oh yeah, floats. Yeah. I don't, it depends on how people experience those things, but I think, but I think they can be really, I really do think that they can be really helpful.
You haven't tried it though.
I have done a float before.
Okay. I'm curious how it is.
I've tried a lot of these things. You know what? So it was a little scary for me, I'm not gonna lie, because it was like a little room and then like it was dark, like the dark, and I couldn't see the end of it. Like, but then I did do it. I had to keep the door cracked. And keeping the door cracked so a little bit of light came in, I actually had 2 hours in that flow. And it actually was very like calming, and I appreciated it. And I think it also helped me. Like I ended up getting over my fear and like touching the end of the wall, which was a super fear of mine. And once I touched it, I was like, okay, you're good. Yeah. And then I could kind of like, I don't know, just be. Yeah. I was really there and I just was in that moment. I don't think I would do it again, but I think that experience, I would consider it as therapeutic and it was helpful. And I can see why people would do it.
Yeah. And that reminds me, like, I think this is therapeutic, but can touch on like maybe this holistic healing. I think us being able to put ourselves in like different experiences, but also trying new things too. Like that float, it's like, well, that doesn't sound ideal, but you really trying to like push yourself and do it, right? The hike, I'm like, I would never want to go on a hike, but actually being open, right? We always talk about being open so much and in openness, because when you do engage in those things and like push yourself, do it when you didn't think you could do it, that itself can be healing for us, for just our inner like confidence. Maybe take us to this other place of like healing that we didn't know we needed.
I agree. When I think about other things like meditation, 20 years ago, meditation was just something that I just could not do. And I couldn't understand how people could just sit and not think and not like make things up in their mind, or have like my world and my mind has always been pretty expansive.
Mm-hmm.
I took a class in college one semester, because I wanted some grad credit and they offered it. And it was a meditation class. And honestly, I hated that class. And then we had to actually practice meditation. And people are sitting there and like really into it. I'm like, this is like, I didn't understand it. And it was excruciatingly, like literally painful to have to sit there. And so in my mind, I wasn't meditating. I was actually just like thinking about things and making plans. And I was just doing all these mental activities, which is what I was good at. Fast forward, maybe 15 years later or however long, 10, 12, whatever years later, I had a friend who introduced me to a lot of these like interesting things that I would never do, like the float. But I went to a meditation studio. Like I actually left my house. I drove, I parked in LA, paid the meter and walked into the studio. And that's a lot of work to do for something that I don't like. And I loved that. I loved that place. And I would do it again and again and again. It was like something shifted for me. And I think I progressively got to the place where I could do it. And so meditation is something that I really, really enjoy, especially like going to a meditation studio and having someone walk me through and doing sound baths. Again, I wasn't able to do that.
Yeah.
Breathing. I think I did laugh breathing or something weird, but I shouldn't say it was weird, but it did feel weird to me, to be honest with you. It was amazing. I mean, my other friends took me there and it was like, wow, like you could laugh in a certain way and breathe in a certain way.
Yeah.
And the way that it could affect you is like, I don't know. I felt so calm.
Yeah. Yeah. See, you're open.
Yeah.
You're open. Yeah. And that and there's more and more research now on like the somatic type forms of healing. And I think about like the sound bowls and healing. I want to do more of that also. So I like that we can be, even as therapists, obviously open to like different forms of healing too. Obviously we're pro therapy, but we appreciate like the element of having like holistic healing and just a lot of practices that have like been here before a lot of us have even been here too, right? There's a lot of like indigenous practices and stuff that are just like, no, that's not real. Like, let's introduce you to all this like Western type medicine stuff. But there's something special about some practices that are overlooked too.
100%. And I'm glad you said that, because I think we're finding a lot more now that a lot of practices that we maybe discounted or, put them over here in the margins, that they're actually becoming a lot more mainstream now.
Yeah.
And we need to definitely give credit where it's due, because a lot of them are indigenous forms of healing that in the past we prioritized Western forms of healing.
Yeah.
And we definitely know now, particularly somatic stuff, that it's really helpful.
Yeah, no, definitely. I know we've covered a lot. I had another question, but I think we answered it of like, again, comparing like the therapeutic versus therapy and what aspects are missing. But I think we've discussed the long-term impacts. We discussed the feedback, right? The therapist feedback hopefully should be like unbiased, neutral, compared to like friends or family. Sometimes you don't get that. The validation piece, you can get this from other people, but there's a certain type of validation we're able to provide in therapy that I think that's helpful. And then you kind of alluded to this of like, we're able to pick up on certain things based off of what you're actually saying, maybe what you're not saying, but we feel you're probably trying to say. And there's just these blind spots I feel a lot of us have been trained to try to pick up on, or at least help you identify that maybe you're not getting that from just like your average conversation. Definitely not from AI also.
Not yet.
Not yet, right?
When they can do that, then I'm going to be scared.
Yeah. So those are maybe some things that are like missing. And again, just going back to that holistic approach.
Thanks for tapping in to All Things Authentic. Make sure you subscribe to the channel. For full episodes, find All Things Authentic on your favorite podcast listening platform.